Next, we have Dr. Samvedya Veenish, who will be talking on clinical profile and management outcomes in children with optic nerve glioma.
Good morning. Today I'm going to talk on clinical profile and management outcomes in children with optic nerve glioma. Optic nerve glioma represents about 2 to 5% of pediatric brain tumors. It can arise sporadically or as a part of tumor predisposition syndrome, such as neurofibromatosis 1. It mainly involves the precortical visual pathway, and they are generally low-grade tumors with unpredictable and varied course. A standard treatment approach to this is still controversial. Our aim was to highlight the clinical profile of 3 children diagnosed with optic nerve glioma and their management outcomes. It was a retrospective case series done during April 2020 to December 2023. A thorough ophthalmic evaluation was done and MR imaging confirmed the diagnosis. An additional test such as VEP, OCT, RNFL was done. So moving on to case 1 was a 2-year-old female child who presented to us with left eye protrusion since 1 month. On examination, there was unsteady fixation, abaxial proptosis, extraocular movements were restricted, there was a relative efferent pupillary defect, and her fundus showed disc edema. MR imaging showed a fusiform enlargement of the left optic nerve. So after consultation with a pediatric oncologist, we decided to observe the child for 2 months to see if there was a increase in lesion or deterioration of the vision. So 2 months, it was seen that there was increase in proptosis, and her MR imaging showed tumor progression, and her genetic confirmed neurofibromatosis. So the child was sent to pediatric oncologist for chemotherapy. After 4 months, the child came back to us without starting chemotherapy. There was worsening of clinical symptoms, and her MRI showed further tumor progression. So the parents were counseled regarding the need of starting chemotherapy, and the child was started on systemic vincristine and carboplatin. This was her clinical picture post chemotherapy. There was reduction in proptosis and improvement in her ocular motility, and her vision at 36-month follow-up was 624 in her left eye. Moving on to case 2 with a similar clinical picture, this was a 6-year-old female who presented to us with right eye protrusion since 2 years. On examination, there was bilateral proptosis with vision 612 in right eye and 69 in left eye with associated multiple cafe au lait spots. Since it was a progressive bilateral disease, we advised chemotherapy, and after 1 month, the child came back to us without undergoing chemotherapy, for which the parents were counseled to start chemotherapy. So follow-up chemotherapy after 1 year post-chemotherapy, her vision in right eye was 6.9 and in left eye was 6.6 parts with stable fundus and stable OCT RNFL. Case 3 was a 3-year-old female child with sudden onset squint in right eye since 2 months, and her vision was C of half meter in right eye. Her fundus showed right hyperemic disc, and her an MRI showed fusiform enlargement of the right optic nerve. Since it was a progressive lesion, again she was advised chemotherapy, but she was advised a transcranial excision of the tumor elsewhere, so the bystanders were more in favor to undergo surgical excision. Post-surgery, the repeat MRI revealed a residual lesion which was persisting in her repeat scan, hence the child was advised for chemotherapy. After 36-month follow-up, post-surgery and post-chemotherapy, her vision in right eye was no PL, and a repeat MRI revealed a regression of lesion, but the vision remained no PL in right eye. So to summarize, case 1 and case 2, post-chemotherapy had improvement in visual acuity, whereas in case 3, post-surgical excision and following chemotherapy, the vision remained no PL. So to discuss, we would like to say that 3 cases of progressive optic glioma in female children, wherein 1 case was confined to optic nerve and the other 2 had chiasmal and optic tract involvement. 2 cases had associated neurofibromatosis, and in all 3 cases, parents were hesitant to undergo chemotherapy. The history says that optic nerve glioma being a non-neoplastic and self-limiting tumor. So being a benign tumor, why should you treat? Because there is a threat to visual function, and a poor vision, especially when both eyes are affected, will lead to a decreased quality of life in children. Glioma has a variable outcomes. The treatment options are still controversial. It is observation versus treatment. Treatments are in the form of surgery, indicated for disfiguring proptosis with no perception of light. Radiotherapy, current recommendation says better to avoid or delay in pediatric age group. Chemotherapy is the first line of treatment of choice in a progressive disease. Systemic chemotherapy, the first line chemotherapeutic agents, vincristine and carboplatin, are well tolerated and they have a good safety profile with no reports of any secondary malignancies or treatment related mortalities being reported. In literature search, we found that children who underwent chemotherapy had a favorable visual outcomes. And so to conclude, I would like to say that more awareness is required regarding the need and safety profile of systemic chemotherapy in progressive gliomas. A close follow-up is mandatory, and initiation of systemic chemotherapy at the earliest sign of progression is required for better functional and cosmetic outcomes. These are my references, and thank you.
Signs of progression.
Yes.
Otherwise, you will not intervene.
Like depends. It's a visual deterioration and clinical progression of the tumor.
And the first case you showed, the proptosis was really eccentric.
Yes.
Is it usual to see that so much of eccentric proptosis in such a optic nerve
Initially,
glioma?
when she presented, there was no much proptosis, but after 4 months, actually, the accentration was there.
And what was the preoperative vision in that patient who had excision?
Excision CF half meter, counting fingers half meter.
Sometimes post chemotherapy you can have vision loss. So your that NPL patient was
Actually, post surgery, there
she
was
had
no
no
PL,
PL, so
yeah, but the repeat MRI showed a residual lesion.
residual lesion.
Yeah,
That's
so,
why you went ahead. And
yes.
but when she came to you first time, was she still no PL at that time? There
No,
was
no,
PL.
she had vision. CF half
See,
meter was there.